Hi, my name is Dr. M. A. Raja. I am a consultant medical oncologist. Today, we will talk about breast cancer. This is important because as of today, across the world as well as in India, breast cancer is the most common cancer, including men and women, which means the highest number of cancer cases are those due to breast. So, it is important that we have some useful information about this. First of all, let us look at what causes breast cancer. Most people are aware that a family history is very important. So, when there are other women in the family, and when I say family, I mean first degree relatives like mother, sister, daughter, etc., have breast cancer, it is possible that the risk of breast cancer is increased for the other women in the family. But having said that, it is also important to know that only 10% of breast cancer is hereditary. The other 90% is not hereditary. So, there is no need to panic also, especially breast cancer which happens after 45 or 50 years old is unlikely to be hereditary. Hereditary breast cancer usually comes at a younger age. That is one point. Second point, which is relevant to all women, particularly those who are living in urban areas, is that breast cancer is strongly linked to obesity, that means excess weight, and it is also coupled with the kind of diet that we eat and exercise that we do. A high fat diet and a lack of exercise both will increase the risk of breast cancer. This high fat diet point is very important because nowadays lot of people are eating outside regularly, and you have to remember that outside food is always high in fat content. So, we should look very carefully at what we are eating and also make sure we are not leading a sedentary lifestyle. We should do some form of exercise every day. This is very important. Next is, what are the symptoms of breast cancer? The most common symptom is a painless lump. Now, in order to feel a painless lump, every woman should first be aware what the normal breast will feel like. So, I strongly suggest that all women, particularly those who are in the age group of 25 to 45, should learn from online and then practice something called breast self-examination. This should be done only once a month, usually 1 or 2 days after the monthly periods. It will take approximately 15 minutes. All it requires is privacy and a good mirror. The idea is, if you start doing this regularly, you will become very familiar with the normal texture, normal appearance and so on of the breast, so that the moment something abnormal happens, you will become aware of it. I say this because in India particularly, most women unfortunately come with breast cancer which is what we call locally advanced. That means it has already increased significantly in size, which automatically reduces the chance of cure. So, it is important that women practice this. It costs nothing extra. In addition, women who are 45 plus should also undergo what you call a mammogram screening once a year, because this can detect very early breast cancer when even a lump is not palpable by the woman. Younger age women should not undertake mammogram. It is only recommended for women who are 45 plus. There are special situations like hereditary breast cancer where after consultation with the doctor you can consider mammogram at a younger age. So, this is as far as detection is concerned. The rest is mostly medical once it is diagnosed. You should also be aware that today breast cancer, even though it is so common, is also probably the most treatable cancer. Broadly speaking, there are 3 kinds of treatment: surgery, radiation and medical treatment. I especially say medical treatment, not chemotherapy, because today in breast cancer, chemotherapy is only one part of medical treatment. There are other non-chemotherapy forms of treatment which are also available, and you should be aware of this. The kind of treatment given depends on the stage of the disease at the time of diagnosis, the age of the woman, whether she is pre or post menopausal, whether she has other serious diseases, then other practical issues like feasibility, logistics, cost and so on. And I say this point because very often in our society we tend to compare. Moment somebody has a breast cancer, you are flooded with information by friends and relatives about other people's experience. Please beware, the experience which they are relating may not apply to the new patient. So, it is best that you discuss with your doctor as to what treatment is applicable to you and discuss the good effects as well as the side effects. It is better not to pay attention to information which is not valid. Thank you very much.